The cognitive treatment of criminality, anger management. Anger management. A common application of CBT for offenders is anger management. Endorsed by Raymond Nacaro since the 1970s, Nacaro describes anger as a strong emotion that has an impact on a person's physiology, behavior, and cognition. Anger management teaches relaxation techniques to deal with the physiological response to anger, for example, increased heart rate, cognitive reconstruction to restrain thought patterns, and timeout, or assertive training to deal with the behavior of anger. The primary aim of anger management is to help offenders control and manage their anger so individuals commit less crimes. It aims to identify triggers so they can be avoided or managed going forward. Techniques seek to change how both the offenders think about their behavior and their behavior. Anger management programs can be undergone in prisons, voluntary or mandatory, via their sentence. It can also take place in the community and be given instead of a custodial. It's usually done in small groups for about 10 sessions. The offenders may be asked to complete anger diaries. They will complete this every time they feel anger. With support from a therapist, they will start to recognize triggers for their anger and be in a position to evaluate which anger management techniques are effective for them in specific situations. There are 3 steps of anger management. Step 1. Cognitive preparation. The offender identifies situations that may provoke anger so they can recognize when aggressive outbursts may occur. Thought patterns are challenged. They also consider negative consequences that may occur due to their anger. Step 2. Skills acquisition. New coping skills are learned to help deal with anger-provoking situations such as relaxation, avoidance, social skills, alertness, and conflict resolution. As anger is a normal emotion experienced by everyone, offenders are not taught to be fearful of becoming angry. Instead, an emphasis is on giving the offender the skills they need so they can control their anger. Step 3. Application practice. Offenders role-play a variety of scenarios to practice their new skills and to control anger. These are conducted in controlled environments so offenders feel safe and untrained individuals are not to expose them to a risk of harm. Supporting research, Ireland 2004. Procedure. They assessed 50 young male prisoners on an anger management course with 37 control prisoners. They found that 92% of prisoners showed an improvement in their anger management, showing how anger management can be effective treatment of criminality. However, there is a problem with this study. Offenders may be dishonest on psychometric assessments measuring anger, and they may try to show that they have either improved their anger management skills or minimized their anger experience in the first place, as they use self-reporting data, and it's not exclusive to the treatment of offenders. Offenders have a greater incentive to lie by looking good for parole or by looking good to the public. Sense of using anger management to treat criminality. Now, anger management has been shown to be effective to treat criminals who have an anger issue. However, it's only effective to treat criminals who have an anger issue. Not all criminals commit crimes because they are angry. For example, psychopaths. Before attending anger management, offenders will be interviewed to assess whether this would be a suitable treatment for them. It's also been shown to be effective for those who are motivated to change their behavior, who are committed to the program. Howes et al. 2005. Direct. Treatment aims to tackle the root cause of the issue, establishing when and why the individual becomes angry, and this allows for long-term changes to be made. Effective. Holbrook 1997. It has been found in a group of 26 offenders that were following an anger management program to have a significant reduction in vengeance scores. Side effects. Due to lack of medication needed with this type of treatment has no side effects. Weaknesses. As stated before, anger management does not work for all offences, as not all offences are violent ones. For example, robbing because you need food or money. Slow. It takes 10 sessions, which could take place weekly, meaning offenders do not have the tools necessary to limit their anger in the meantime. Relapse. There is little evidence that anger management programs actually reduce the rate of reoffending due to a limited correlation between anger management and committing crimes. This is likely due to social factors like poverty. Ethical. Can be seen as a form of social control, getting the individual to behave the same way that is deemed socially acceptable on the basis of a therapist. Type of person. Anger management only works if the offender wants the treatment and is motivated to have it. Anger management programs can also have undesirable effects on people. For example, psychopaths can use the skills they have learned to their advantage.